Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. My name is Erna Rohmawati. I'm from Universitas Muhammadiyah Yogyakarta, School of Master in Nursing. And today I would like to present our study, which I conducted with Akbar Usaun. And the title of our presentation today is Effectiveness of One-on-One Training Program on the Preparedness and Caregiving Burden of Relative of Patient with Life-Limiting Illness. Before I start my presentation, I would like to thank to the ICONUS committee for conducting this excellent conference. As the background, the number of patients with palliative care needs are increasing over the year, and most of the patients with palliative care needs that is caused by life-limiting illness, they will experience multiple symptoms, not only physical like pain or dyspnea or nausea, but also like psychological and also spiritual symptoms. And the majority of the patient prefer to be cared at home. It is based on finding from previous study stated that the majority of the patient wants to be cared at home, although at their end of life, their patient's expectation of the patient preference were not met. As the patient wants to be cared at home, of course, the family members will have an important role, especially for a country like Indonesia, which culturally family has an obligation or a like high responsibility to provide caregiving for the family members who experience illness. And unfortunately, the majority of the families are not prepared to provide caregiving. That can be due to the education background and also like their exposure to health information. So this will create a caregiving as a burden for the relative. The process of caregiving itself and also the less prepared creates more caregiving burden for the relatives. One study suggests that providing training for relatives will increase family in the preparedness, and at the end, it will also reduce the family caregiving burden. So our study aimed to investigate the effectiveness of one-on-one training on the family caregiving burden and also on the family caregiving preparedness. So the design of our study was pre-post-test with control group. We involved 50 relatives in the study. We got the data of the family or the relatives from the primary healthcare centers, and with 25 relatives were in the intervention group, while the other 25 were in the control group. And we conducted the study or the intervention for 3 weeks. So we provided one-on-one training. For example, in the first week, we provide information or training how to conduct or how to do the basic care need, for example, the hygiene, also on how to provide meals for the patient at home. And then in the second week and the third week, we focus on the symptom management from the physical, and psychological. For example, in the physical, we provide training to improve family skills in, like, for example, to manage patient's pain or patient dyspnea or patient nausea. And after the 3 weeks, we measure the outcome. Of course, we also measure the outcome in the first week prior to the intervention, and also we measure again after the intervention finished. For the measurement, we utilize 2 instruments which are already validated and reliable. So the first one is to measure the family caregiving preparedness. We use tools that is developed by Merluzzi, caregiving inventory, and then to measure the family caregiving burden, we utilize the burden scale. So after the 3 weeks, we measure, and now we focus on the result and discussion. In these slides, now we can see the characteristic or the demographic characteristic of the relatives. Between the intervention and the control group, the general almost similar. The majority were female. And based on the previous study, women tend to have a higher burden than men in caring for patients at home who have a life-limiting illness. And in this study, we categorize the age. So the majority of the relatives were less than 56 years old. And previous study also stated that age is one of the factors that contribute or influence the burden of family caregiving. It means that the older of the relative who provide caregiving, it will increase the burden that they experience. The relationship between the patient and the relative are spouse, children, and also parents. And the length of the caregiving, the majority of the relative already provided care to the family members who are ill for more than 1 year. According to a study conducted by Xu Ying et al. In 2008, families who spend more time providing care to the patient, they will have a lesser time for themselves, and it will increase the burden, or the burden of the relative will be heavier, and it will interfere the other activities. And regarding to the caregiving preparedness and caregiving burden, we measure after the measurement, we found that after the intervention, there is an increasing preparedness of the family caregivers, and also a decrease for the burden. And when we compare between the intervention group and the control group, the post-test, we found a significantly increase in terms of preparedness in the intervention group, and significantly decrease in terms of caregiving burdens. Previous studies states that family burden will decrease as well as when the preparedness are increased. This is happen, when the relative were provided with psychoeducation in the previous studies. So in other studies also state that the family or relative preparedness increased after home-based training, a study conducted by Kiza et al. Although there is a different context between our study and Kiza, while in Kiza they focus on the relative with a patient with colorectal cancer, our study, as you see in the previous slide, that we not only focus on cancer, but also involved in other life-limiting illness. But we can found that the preparedness also increased after providing one-on-one training. So we can conclude that our intervention that is providing one-on-one training on managing symptoms for 3 weeks can increase the family caregiving preparedness, and also can reduce the burden of caregiving for the relatives. So from our study, we can recommend that healthcare professionals, especially nurses, they can provide like a simple strategies or simple education for the relative, and how to manage or how to address symptom that is experienced by the patient at home. I think that's all for our presentation today. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.